We find some of these valve procedures as valvotomy, which is an incision into the valve, valvectomy, which is an excision of the affected valve, valvuloplasty, a repair of this affected valve, a valve repositioning, and a valve replacement. At the end stage, when there is no possibility of repairing the valve or making an incision or an excision, the provider might go for a complete replacement valvular procedure, which is also a major surgery. Okay, in such cases, you need to understand what is a type of valve that is being replaced. It might be, this valve might be a bovine valve, meaning it could be a xenograft, or it could be a stentless valve. Okay, so you will have to understand the type of valve, what is being replaced, and most importantly, what needs to be seen, especially with regards to this valve replacement, is you should be knowing what is a valve that is being affected, because we have separate codes for all of these valves. Next is, when coming to valve replacement, you should be knowing whether the procedure is done as an open technique or as a transcatheter technique, which is a interventional technique, meaning they are going to place a valve via passing these catheter or these prosthetic device into the patient's veins, through the patient's veins. That is a transcatheter placement. For that placement, you need to know through which vessel is a physician is going to initiate the procedure. Is the physician going to initiate the procedure by inserting the catheter into the axillary artery, or is it from the femoral artery? You should be knowing that, because you have separate codes for the approach also. So code for the, you'll have to know the type of approach and whether it is an open approach or it is a transcatheter approach.